Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Tennessee. Welcome to another Ask the Expert show, where for the last 16 years, we have brought you the finest experts in the field of legal, health, financial, and home improvement. Hey, when I found out that we were going to have one of the top eye surgeons in the state of Tennessee, I was so excited. Hey, when you get to my age, the eyesight starts to go, there's LASIK, and then there's cataracts, there's dry eye. So I was so excited, but I got to tell you, we've been doing this show with Wang Vision Institute for about a year now, and I learn new things every month. By your letters, you learn new things every month. Let me welcome one of our favorites, Dr. Jones. Good morning, Dr. Jones.
Good morning, Steve. Thanks for having me.
I love doing this show. I think when it comes to the eye, especially because we have a more mature audience, that a show like this is so important. And even the letters that we get, people saying, how come there's not more shows on eye surgery? I really enjoy yours, but ours is just on once a month with you. This is such an important category, Dr. Jones.
Yes, absolutely. I agree.
So there's so many new people finding the show. Tell people about Wang Vision Institute.
Yes. So Wang Vision Institute is a medical practice. We see patients that kind of run the entire gamut of eye problems from the front to the back of the eye, but we mainly focus on vision correction surgery. So this is going to be things like laser cataract surgery, lens replacement for vision correction, and then things like laser vision correction procedures like LASIK and SMILE, implantable contact lens. But we see a wide variety of medical problems. We're a dry eye center. So we see a lot of patients who have had chronic dry eye that maybe haven't had relief with over-the-counter drops, and they come to see us for their medical eye exams, and we do various procedures for that as well at our clinic.
Well, I got to tell you, from doing this show, I realized that I have dry eye. We're talking about dry eye today, and it's probably one of the most uncomfortable things to go through with dry eye. Tell people exactly what dry eye is and what causes it.
Yeah, that's a great question. And in our clinic, dry eye is on a daily basis going to be probably the most common thing that we see. Even more common than cataracts and other eye problems. It's going to be dry eye. It's going to be the top diagnosis we make on a daily basis. Dry eye syndrome is just where there's some kind of deficiency in the tear film that coats the surface of the eye. And it's either a deficiency in one or two parts. There's an oil component to your tears, which rests on top, made by oil glands on the eyelid margin, called meibomian glands. And then there's a water component, which is made by the actual tear glands located around the eye and on the surface of the eye. And so dry eye is going to be basically some kind of deficiency in one or both of those components of the tear film. And the most common risk factor, the most common cause is really just age. As we get older, the oil glands on the eyelid margin start to not work as well. They start to get clogged and inflamed. And this leads to inflammation in the tear film, which can cause dry spots to develop. And then, of course, as we age, the water component, the amount of actual water in the tears that we make is reduced just normally with age. There's other things that exacerbate dryness, like menopause and autoimmune diseases. People who take chemotherapy medications can suffer from dry eye. And there's a whole host of other, previous eye surgery like LASIK sometimes can have a little bit of dryness afterwards. So there's a whole host of things that can exacerbate it, but the main risk factor is going to be age.
Okay, so this is what I went through. So I didn't know there was what the difference is between a normal eye irritation and chronic dry eye. I had no idea until we started doing this show. Tell
Sure.
people about that.
Yeah, no, that's a great question. Most people at some point in life have experienced some kind of, irritation, whether it's due to something in the environment, really dry air, it's wintertime, dry eye becomes more common. That's pretty normal. But if you're suffering from chronic on a daily basis, waking up in the morning, eyes burning, tearing, hard to even open the eyes, maybe throughout the day it gets a little bit worse, maybe it gets a little bit better, and then maybe it starts to flare up again at night towards the end of the day. A lot of symptoms of dry eye can actually be fluctuating vision. So a lot of people come to me with symptoms of, eye strain and just having a lot of fluctuation when they're working on the computer. Maybe because of their job, they're on the computer many hours a day. That fluctuation in vision can actually be due to dryness as well. It's very, very common for our eyes to dry out while we're watching TV or driving or working on the computer. We're not blinking quite as much during those activities, and that's a major cause of dryness that we see, sometimes not just in older patients, and younger patients as well. And so chronic dry eye is going to be something where there's some kind of deficiency in either the tear film or the eyelid structure, and people are experiencing dryness on a daily basis consistently, not like once in a while their eyes feel irritated.
That is so true. I get the burning sensation when I've been on the computer. That's
Yeah.
it always. And I listened to you, and I got eye drops. It's helped a bit, but
Mhm.
it's the burning situation. It's just very
Yes.
annoying.
Yeah, blinking, the blinking natural reflex of the eye is a little bit underrated. It's really critically important to actually keep the surface of the eye lubricated because it spreads the tear film around over the surface of the eye. And if your tear film's normal, it may not necessarily be a problem to not blink as much if you're on the computer many hours a day. But for a lot of people, especially as we get older and women, once they reach menopause and whatnot, the tear film starts to become a little bit insufficient on its own. And if you're not blinking throughout the day, it's really going to actually cause quite a bit of dryness on the surface of the eye. So blinking is very important. This is also why we see a lot of people complaining of dryness when they wake up first thing in the morning. Their eyes
Yes.
like there's sand in their eyes. Is because they have a deficient tear film, number one, but also when we're sleeping, we're not blinking at all. And so there's stasis of the tear film on the surface of the eye. It's not adequately providing coverage. Not to mention, a lot of times this time of year, the air is very dehumidified. So you've got dry air, insufficient tear film, not blinking, perfect setup for a very significant amount of dryness, which impacts quality of life, impacts vision and quality of life quite a bit, we see in our clinic.
Dr. Jones, can it lead to more serious problems?
It can. It's rare that it causes anything super vision threatening, but certainly really very severe dryness can blur the vision. So that's, a negative impact on quality of life. Very rarely, really severe dryness can cause infections and problems with developing erosions, which are like small abrasions on the surface of the cornea that might require additional procedures and treatment that we do in our clinic. So there are, in some cases, it can be so severe that it can actually cause vision-threatening problems. Yes.
Wow. So what about, it's not a gender demographic, but there is an age demographic, right?
Yes. Definitely. I mean, just as people age, so dry eye is going to be much more common in someone who's 85 than 35. As we get older, as the rest of our body ages, the aspects of the eye that help make the tear film are going to age as well. And again, that's going to be the oil glands are going to atrophy and become clogged and inflamed, and we just make less tear volume from our lacrimal gland as well. We see dry eye, though, across the entire spectrum of ages, though. It's not like it's something that's just in older individuals, but it is a lot more common because of the age-related changes that occur in the eye. But some of the most severe dry I've seen are in younger people who maybe, have been working on the computer all day for many years, and they just experience a lot of fluctuating vision. They can have very severe dryness, actually.
I got to ask this is a personal question for me, and I'll get right back to dry eye. But about 20 years ago, I got a sty in my eye, and I
Yeah.
actually had to go to the doctor to have it lanced. But I don't ever hear about people getting a sty in their eye. Is it still happen?
Oh, yeah. Styes or chalazion, which is another medical term for it, are very, very common. We see it all the time in our clinic. Styes are just where one of those oil glands, like I mentioned, that makes the oil part of the tear film, just gets blocked and gets very acutely inflamed. And so it requires you, as the patient, to do very frequent warm compresses, and sometimes antibiotic drops can help.
Yes.
Sometimes it does have to be
It
cut
did
open
help
and
me.
drained. For severe styes, we sometimes do have to do something surgical like that. But styes are super common, and it's the exact same pathology that I mentioned. It's as we get older, and some people are naturally predisposed to their oils and the oil glands hardening and just clogging off the orifice of the oil gland, and that leads to a lot of inflammation inside of it. So it's very common. We see it all the time, actually.
What about, uh, are there different types of dry eye? And does each one have a different treatment?
Yeah, I mean, that's a good question. I mean, there's different medical conditions that can cause dryness. The most common two types of dry eye we will see in the general population are going to be primarily aqueous deficient, which means the water component of the tears is lacking, or primarily what's called evaporative dry eye, which is where you blink and the tear film starts to evaporate really quickly. That's going to be the most common by far. That's either a deficiency in the oil part of the tear film or the mucus part that makes up the aqueous part. So it's some kind of deficiency in one of the components of the tears. But by far, the most common thing we see is evaporation of the tears. You blink, and then we can see right at the slit lamp the tears starting to evaporate very quickly right off the surface of the eye, and it starts to create dry spots. That's most common. There's other medical conditions with the eye, like people who've had trigeminal nerve surgery for issues can develop improper nerve function in the cornea. That leads to very severe dryness. Some people don't close their eyes completely when they sleep at night. Their eye is a little bit partially open, and they develop a very localized patch of dryness that creates a lot of astigmatism. That's called exposure keratitis. So there's different things that can cause dryness. Those are more rare, but the most common is just going to be evaporative dry eye, some kind of deficiency in one of the components of the tears that's leading it to be very unstable on the surface of the eye.
So, just for a second, getting it back when I had the sty, there was over-the-counter
Yes.
drops that you could buy, but they
Yes.
didn't help at all. So that's
Yeah.
why I went. But is it the same thing like with dry eye? I use Blink, which
Yes.
is
Yes.
apropos. But
Yeah.
when do you know it's time to? Well, first of all, are there any products that are better than others? And when do they know it's time to be treated by you?
Yeah, that's a great question. For all cases of dry, it's a good idea to use over-the-counter lubricating drops. As you alluded to, Blink is a brand name of one of the artificial tears available over the counter. There's other brands like Sustain Refresh, Blink, TheraTears. I wouldn't say one product is necessarily better than the other. They're all kind of function in the same way. They just act as supplemental moisture to the surface of the eye. Those are good ideas. It's a good idea to do warm compresses on your own at home with like a warm washcloth or one of the dry eye masks that
Your
you get
dry eye.
to it. Yeah. And you can wear it over your eyes and do some massage. That helps the oil glands kind of function a little bit better. But a lot of patients that come to see us, they've tried these couple of things and it's just not quite been sufficient. They still are very symptomatic throughout the day. And there's very easy things we can do in our clinic that are procedural based that will help a lot with dryness. We can place punctal plugs, which is a little dissolvable plug on the lower eyelid punctum that helps retain moisture on the surface of the eye. So when you place Blink eye drops or Systane, whatever you use, they'll actually retain on the surface of the eye a lot better and will work a lot more effectively. So that's one thing that we do, or at least that I do for the vast majority of my dry eye patients. Another thing, you can do warm compresses at home, like I mentioned, but we actually have a device in our clinic that does a much more effective and targeted kind of warm compress. It's called a thermal pulsation device. So it uses heat and massage to the eyelid margin to very specifically heat up that region and use a little bit of very gentle pressure applied to the eyelid margin to actually express out trapped oils out of those oil glands. That will really be helpful acutely. It'll help your symptoms in the short term, but it actually helps the longevity of the oil glands so that they don't atrophy and die out with time. Because some of the most severe dry eye I see on a daily basis is in much older, pretty much elderly individuals who have had chronic dry eye for many decades. And actually a lot of the oil glands on the eyelid margin have actually started to die off. They've started to atrophy and they're just not even there and not even functioning anymore. This is some of the hardest dry eye that we are treating in our clinic. And we actually do have a treatment as well for even severe dry eye cases, which is the dissolvable amniotic membrane contact lens that we invented, Dr. Wang invented in our practice many years ago. And it helps the stem cell population of the eye repopulate and will help even really severe dry spots heal. So that's kind of a treatment option for more severe cases. But just starting with punctal plugs and thermal pulsation can actually be quite beneficial.
How often do you have to come in for that treatment?
Yeah, that's a good question. The type of plugs that I find most effective will dissolve in about 6 months. And likewise, the thermal pulsation that we do, the effects of it, some patients can go a year without needing it again, but most I would say would benefit again in 6 months. So on average, even for mild dry eye, we're seeing patients every 6 months for treatment. Yeah.
You don't see this. We're getting a lot of questions, and people want to know, is dry eye covered by insurance?
That's a great question. Yes. So dry eye is a medical diagnosis. And yes, some procedures, like example for punctal plugs, are definitely going to be covered by insurance. Amniotic membrane dissolvable contact lens, like I mentioned, is also billable to medical insurance. It's been studied and been shown to increase the stem cell population on the cornea. So insurance will cover that as well. Some other things like IPL and thermal pulsation, there will be an out-of-pocket fee for that. That's correct.
What about punctional plugs?
Punctal
How
plugs.
do they help dry eye?
Yeah, the punctal plugs are these little dissolvable, almost cylinder-looking plugs that go in the punctum on the lower eyelid. If you pull down your lower lid, you'll see, if you look in the mirror, there's a little space. There's a little opening in the bottom corner towards your nose. That's called the lower punctum. If you place a very, very tiny plug inside that punctum, it will reduce the outflow of tears from the surface of the eye. So tears will accumulate on the surface of the eye a lot more effectively, and that will help heal dry spots. That'll help your eyes feel more comfortable. And like I said, we do that all the time. I mean, I do it on a daily basis in clinic for patients with dry eye. It helps quite a bit.
How about amniotic membrane grafts?
Yeah, the amniotic membrane dissolvable, it's basically what it looks like. It looks like it almost looks like a contact lens when you look at it, but it's very thin and it will actually start to dissolve on contact with the eye, almost like a little Listerine strip. When you put that on your tongue, it starts to evaporate almost immediately and dissolve. The amniotic membrane is the same thing. It's placed on the surface of the eye and starts to dissolve, and it releases these molecules that actually help the stem cell population of the cornea repopulate the surface cells and helps dry spots heal. And so this is really effective, like I said, for more severe dry eye cases, but it can be done for milder cases as well. It's a very quick and easy procedure. There's nothing to it. We do it right at the slit lamp. You don't feel the contact lens. You don't see it at all. It doesn't impact your vision because of where it's located and how thin it is, and the fact that it dissolves pretty much within 24 hours. It's pretty much mostly dissolved.
You know, I was taking vitamin D, which you can buy over the counter, but I got a prescription for it. Are there the same things with eye drops for dry eye, that you can write a prescription, something stronger than what you buy over the counter?
Yes, absolutely. There are over-the-counter drops are mainly just for lubricating purposes, but there are prescription drops that actually can help reduce inflammation in the tear film and help it be a little bit of higher quality long-term. And so that's going to be prescription drops you may have heard of, like Restasis or Xiidra or cyclosporin, VEVI, Mibo. There's a whole host of different prescription drops that we can prescribe that are definitely helpful. Only problem with these drops is you do have to take them consistently for many, many weeks before you actually start to see a benefit. They don't work immediately, so that's a little bit of a downside. A lot of patients want immediate relief because they're really bothered by their symptoms, but these prescription drops can be very helpful if you stick with it long term. Absolutely.
Dr. Jones, I want to personally thank you. Each month, you and Dr. G take time out of your day to give such incredible information. People so appreciate you. How do they get a hold of Wang Institute?
Great question. We have a website, which is wangvisioninstitute.com, where we have information about all the surgical procedures we offer, links to schedule consultations if you're interested. There will also be a link that'll take you to the webinar that we do every Tuesday evening, where Dr. Gaduru and myself will discuss more in depth all of the different procedures that we offer. And then our office phone number is 615-321-8881 if you're interested in talking to someone on the phone.
Great. Hey, you'll be back again with us next month. Dr. Jones, as always, thanks so much.
Thank you, Steve. Appreciate it.
Yeah, it was Dr. Jones with Wang Vision Institute. That's going to do it for us today. Hey, we'll be back again next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.